So how do we handle exercise training in persons with heart failure? They don't have to deviate very much compared to people who have heart disease in general. So when we look at their aerobic training, so they can do modes. Let's look at their types. So walking, the cycle ergometer. They really can't jog. They don't have a high enough VO2 max to jog. People can cycle outdoors if they're stable enough, or maybe they're one of those persons whose VO2 maxes are higher than 5 METs. 40 to 80% VO2 max. So we're looking for moderate intensities, perceived exertion levels about 13 if they can do that. They may be able to do some interval training where they go slightly higher intensity and come down. The goal is to get them the duration, the time, work up to 30 minutes. So persons who have a very low functional capacity are going to need 5 to 10 minute sessions multiple times per day if they're less than 3 METs. 3 to 5 METs, they could do maybe 1 to 2 15-minute sessions per day, and then eventually get people to the current ACSM recommendations 3 to 5 days a week, 20 to 30 minutes, and try to increase duration from there. So if you look at the goals, if you want to progress people, progression, try to get them to do increased duration before you start adding more days, and then intensity would be the last thing that you would add. Resistance training for persons with heart failure. Yes, they can do it. Try to focus on keeping them independent, their activities of daily living. They have to have enough strength to be independent or they can't remain at home. Circuit training can work great. So even things with Dynabands and tubing and light dumbbells. If they're doing machines, 70% of 1 RM. So having them use weights that are 10 to 15 repetitions. What's a little bit different here with these folks is you'd want to focus on individual muscle groups versus large muscle groups. So for example, doing something like a leg extension exercise versus a squat or a leg press. It's less demand on the heart if we're using a smaller muscle group, if we're not doing a compound movement. So smaller muscle groups are typically going to work better. But resistance training is great because it does promote muscle strength and muscle endurance in the extremities, so it lessens the demand on the heart. So anything that we can do that can lessen the demand on the heart and improve muscle strength and endurance, that's going to benefit the client. For persons who have transplants, again, severe heart failure, when they cut the heart, you do get a denervation during surgery, and as a result of that, you're going to have increased resting heart rate and blood pressure. The heart rate doesn't rise as much during exercise. That's called a chronotropic response, but the stroke volume is going to be higher. They're going to have a much lower cardiac output, only 60 to 70% of what they had pre-surgery, pre-illness. And these are people who are going to be really, really deconditioned, because they've had heart failure. They're going to build up lactate higher. And of course, we always have to worry about rejection medications and other medication side effects. They're very deconditioned before surgery. Corticosteroids, so drugs like prednisone, anti-inflammatories, they can lower bone density. We'll talk about this when it comes to cancer and exercise. Cyclosporin, one of the drugs that is an anti-rejection drug, that can raise your resting and exercise blood pressure. The good news is rejection risk goes down after about 1 year, and many people can live a very long time. But people get increased risk of cancers and other infections because their immune system is compromised. So they can, if they get something like the flu, it can be very, very serious. They can still develop heart disease in their new heart if genetically they are able to, they just have that capability to develop atherosclerosis. Their new heart can develop heart disease. And if they don't change their lifestyle, that can happen as well. So you have to really try to work on their behaviors improving their self-efficacy. And so you would use the same type of exercise guidelines for heart failure as you would for someone post-transplant. Unless you are working in a cardiac rehab, you're probably not going to see too many people with a heart transplant. But, many of these people do very, very well. I mean, as a Mustang enthusiast, Carroll Shelby quit working for Ford and racing cars in the 1960s because of heart problems. Well, he had a transplant in the 90s. He also had a kidney transplant, and he just died about a year ago, and he was, 90? I think he was about 90. So he was the oldest living person with 2 transplants. So people can live a very long time even though they've had a heart transplant. And so, know the data with heart disease, go through those slides, know the recommendations when someone is sent to you post-cardiac rehab. They can still do resistance training. Heart failure patients can still exercise. We'd want to lessen the demand on the heart and work on muscle strength and endurance, and understand the special issues with heart transplants, such as rejection and heart rate and blood pressure responses. And we will go through the poll in the class for who is the most at risk of coronary heart disease.